We studied primary care practitioners in the state of Michigan who were caring for people who were insured by Healthy Michigan, the Medicaid expansion. And we looked at primary care practitioners in particular because they're sort of the front lines of medical care. We wanted to see what their experiences were. Primary care practitioners said people are getting care that they would not otherwise get, that they would otherwise wind up in an ER for. People were gaining access to care they didn't have before, that was able to improve their medication adherence. They were getting access to preventive services that they had never gotten before. One of the things that surprised me a little bit was the number that said they saw patients who hadn't seen a doctor in many years. Somebody who had been in Michigan his whole life, hadn't seen a doctor in 40 years, and of course, they found he had diabetes, he had hypertension, and he had had a stroke at some point, which he had never noted, apparently. So, it's amazing. If you can't pay for medical care, you don't go unless you're sick. Sometimes you don't even go then. Some people knew they had chronic conditions or other medical problems, but didn't seek care because they couldn't afford it. Primary care physicians say, yeah, got them in the door, and then we can talk to them about the stuff that they need to do to change their health and their risk. While Michigan's Medicaid expansion has been looked at as an example of financial incentives for healthy behavior and stuff like that, other states can learn from Michigan's example of the primary care-centered nature of our expansion. It's an underappreciated strength. We know from international studies that places that have strong primary care-centered systems do better. They're healthier and they're cheaper. At least according to primary care providers, it's working.